back to the Alex Jones Show. I'm David Knight, live here in studio. We had Alex Jones, who's on the road, join us in the last hour, break down what he sees behind what's going on in Iraq with ISIS. And we wanted to get your calls, let you weigh in on that. We also wanted to get you to weigh in on what you think about corruption in our country today. Now, 40 years after the resignation of Richard Nixon yesterday, what do you think about corruption? What do you think about impeachment? Is that something we should be pursuing? Of course, Boehner announced that he was not going to pursue impeachment. He had no intention of doing that. As a matter of fact, that was all just a plot from the Democrats that was hatched in the White House. They really want the Republicans to impeach them. So what do you think about that? Should we give amnesty to the undocumented worker in the White House, or should we go after corruption and breaking the law wherever we see it? So I want to take your calls on that. And, of course, the Sunday number is 877-789-ALEX. I'm going to go to RJ in Oklahoma in just 1 second. But before I do, I want to let you know that this hour of the Alex Jones Show is brought to you by Survival Shield X2. Harvested more than 7,000 feet below the earth, escaping Fukushima's ground effects. It's 50% stronger for the same price as Survival Shield. And that's the original iodine supplement that we had for our listeners. It's a high-purity source of 99.99% pure grade. We're the only one in the world. Extremely hard to achieve this. It's great for a survival kit due to its extra strength. And you can get it in 5 and 10 packs. That's at InfoWarsStore.com. That's Survival Shield X2. Let's give you some news about what's going on with Ebola. We've got warnings, panic, and all over the country. We've got all over the world, I should say. It was just a week or so ago that we had someone get off of a plane in the UK at Gatwick Airport. She'd been vomiting on the plane. As she got off, she collapsed. Everybody was concerned that perhaps it might be Ebola, even though they didn't see blood. So everybody was panicked. We see that in Saudi Arabia, they had a suspected Ebola victim. They tested him. They did not have the virus. We see the same thing happening in Hong Kong. Somebody was suspected of having Ebola. They took them away. However, these incidents show just how easy it would be for someone who did have Ebola to enter the country via the airplanes. And so workers in the UK who are manning the border, who are at the airports, are very concerned about this because they're the ones on the front line. They're the ones who are going to be exposed first. They're essentially, you could say, the canaries in the coal mine. When you start seeing the border staff dropping over, dying in the airport, then you start quarantining that area. But they don't like being the canaries in the coal mine. They said they're terrified. They're threatening to strike. They said that these are staffers at London's Heathrow and Gatwick Airport. They're furious that no measures have been put in place to preserve their health. Well, guess what? No measures have been put in place to preserve our health either. And they're bringing in people into this country who are sick rather than sending the treatments to them. If you remember when John Bound went to the border and reported on that, Falfurrias was the area, he had pictures of people that had died on this rancher's large ranch there, decaying bodies, various states of decomposition. They were talking about how it was breaking the budget of that city to even bury everyone, let alone provide medical treatment. They had a lot of people who were bitten by rattlesnakes as they were coming across, and they said it was costing them a fortune because they were having to fly in antivenom from another location because in the small town they don't have a hospital that has rattlesnake antivenom there. So the antivenom itself is expensive, and they had to fly it in. But of course, that was cheaper than flying these people to wherever they would get that treatment. And of course, it is much easier if you've got some kind of a treatment, you think, for Ebola. There you can see, if you're watching this live on Infowars.com, you can see some of the slides, some of the pictures of the decomposing bodies, some of them just left as skulls out in that area. A lot of people are dying coming across there. That's why it's so amazing to hear this narrative that it is simply 8-year-old children holding their teddy bears, as George Will told us. That is not the case. The young people who are coming across, even if they're escorted by a parent, that ought to be treated as reckless endangerment. But, of course, they're giving that a pass. But the point I wanted to make about the Ebola connection is that why would we spend the money to try to fly these people back separately in quarantined airplanes rather than just send the treatment to them to help them if we've got a working treatment? I think it is there in order to raise panic, in order to raise an alarm. And, of course, other people have said, follow the money. I think it was Michael Savage took the position that perhaps they're trying to panic the public and then show or pretend that they've got a treatment for Ebola so they can then go out and force vaccinate everyone. And you don't have to do much to get people scared about Ebola. There's a New York Times article today. The title is "Don't Touch the Walls. Ebola Fears Infect an African Hospital." This is an amazing firsthand account of what's going on in Sierra Leone and in Nigeria. They're talking about how so many patients, nurses, and health workers have died in government hospital that many people in the city are seeing the hospitals as a death trap. So they're avoiding the hospitals. And so what they're doing is they're dying in the streets. And as this New York Times writer, Adam Nossiter, went there and was walking through, a Western medical technician yelled out to him, "Don't touch the wall. Don't touch the walls. Are totally infected." He said people don't die here in the hospital anymore. He says they're dying in the community, 5 or 6 a day. And of course, in neighboring Liberia and in the capital city of this country, Monrovia, they said 23 health workers have been infected. The president is calling it necessary for the very survival, he says, of our state and for the protection of the lives of our people to quarantine the area to make sure that this doesn't come across the border. Are we doing that in Western countries? Are we doing that in America? No. Instead, we are bringing people in rather than sending the treatment to them, rather than maintaining a quarantine. Why are we violating all of our health protocols from the CDC? He says dead bodies have been appearing on the streets and the houses throughout Monrovia. But with the hospitals closed, they said most of the bodies are being found in the streets and not in the hospitals, and people are not dying in the hospitals. So they said it's a very dangerous place. They're washing their hands 50 times a day. And this last quote here from one of the Doctors Without Borders logistician said, "There is no system here. There is no isolation. If you make a mistake, you get infected." And of course, when Paul Joseph Watson was talking to Dick Morris on the radio about this, he was saying, well, there's this disagreement going back and forth as to whether or not it is airborne or whether or not you have to have direct contact with the blood. And there's disagreement about that based on some tests that they've done with animals. But of course, when you see doctors and health workers routinely coming down with this, I know it is very contagious and it's very difficult to maintain these procedures, and that may be what's up with it. But the possibility exists that they don't understand how the disease is transmitted fully. Maybe it is transmitted by air and they're not acknowledging that and not guarding for that. Now, as that's breaking, and as we're looking at the possibility of having quarantines and the possibility of having forced vaccinations, this story broke today. This is from My Fox 8 out of Wisconsin. A girl with a sore throat is given the HPV vaccine and dies just hours after leaving the doctor. And they say the only thing different about that day was the shot, said her parents. I was talking about Ebola before the break, and I want to go to Rich in New York, who had called in about that. Rich, go ahead.
Thanks, Dave. Thanks for having me on. I can't believe I got it on my first shot. I'm a long-time listener, first-time caller.
Good.
I can't believe that this country would allow for a contagious disease like that. I mean, even doctors have come forth and said, why are you bringing them into this country? You know that most diseases or most infections are spread in hospitals.
Yes. And that's what I was just reporting at. The New York Times is talking about how everybody was so afraid of the hospitals in Sierra Leone and in Nigeria that they're empty. They're saying don't touch the walls, they're totally infected. People are staying away, but they're still dying. They're dying in the streets, they're dying in their homes, but they're certainly not going to the hospitals.
And the first thing, obviously, you do is contain them, and the contain is not let anybody in or out of the area. You quarantine area. You don't even have to be a doctor to be able to understand that concept.
That's right. That's right. So what's your take behind it? Why do you think they would do that?
I don't know yet. I'm still waiting. I mean, there's been some people saying, well, this is a big spin on Big Pharma coming up with some antidote to cure it and turning it into a money-making thing. I'm not quite sure, but all I know is that from a medical standpoint, that is not the thing to do to start shipping people all over the world.
That's right. It's hard to say. We don't really know what their motives are, but we start asking questions when we see them doing things that make absolutely no sense, that violate all their protocols, that violate common sense, that violate everything that you would expect to see with something that is this serious, this contagious. When they stand down, you got to say, well, why would they do that? It makes absolutely no sense. There comes a time at which you got to say, there's something besides incompetence going on here. There's some other alternative motives that are going on, whether, like we said before, perhaps it is that they want to create a panic and sell or force us to buy their mandatory vaccines, or whether this is just as simple as the people here at the University of Texas, the professor who said he wanted to see 90% of the people on Earth die, and he had said that he wanted an airborne Ebola virus, suggested that would be the way to make that happen. So who knows what their real motive is, but certainly we can't chalk this up just to incompetence. There's something far beyond that. Thank you, Rich in New York.
You are watching the best of the Alex Jones Show, weekdays from 11 a.m. to 2 p.m. Central. Watch live at Infowars.com/show or become a member of InfoWarsNews.com and help us take resistance to the next level.